All right, I think we'll go ahead and get started here because we have a schedule to keep to. We've got some incredible presentations here today. So if you all are comfortable, please feel free to add your pronouns to your name on your chat screen. And yeah, absolutely. So I just want to welcome you all to the session of the 2023 Culture of Data Conference. Thank you all for joining us. My name is Samantha Bertoman, and my pronouns are she, her, hers, and I will be moderating this session. We also have Kelsey Duarte, who is managing the Zoom and making sure that the tech is running smoothly today. You all are muted now, but if you have any questions during the Q&A sessions, please feel free to unmute. You can also use the chat box if you have any questions or need anything. If you are comfortable doing so, please add your pronouns to the Zoom name by clicking the 3 dots on your video square and selecting rename. All right, so this session has been generously sponsored by Champ Software. So we thank them for their contributions to the conference, and I'd like to introduce David Smith from Champ Software to share a few words with us.
David, you are on mute.
Okay, I'm going to share my screen with you and talk a little bit about who Champ is. So hopefully you can see my welcome slide there to the culture of data and youth-led public health. I have been working with local health departments for almost 20 years with Champ Software. And so my name is David Smith, and Champ Software is actually, the word Champ is an acronym for Community Health Agency Management Program. And one of the questions I like to ask whenever I talk to public health professionals is, where is your agency at in the evolution of public health documentation? In other words, how are you documenting the encounters you're having with clients? And 95% of the time, they end up where that blue arrow is, somewhere between the Florence Nightingale era and the ultimate we were supposed to reach 3 years ago of Public Health 3.0, with information flowing seamlessly. You might want to know where Champ's at. Well, we've built the technology to move you or accelerate you towards Public Health 3.0 since 2011. And you can kind of see we've been working with public health departments for 37 years, since 1985. We're located in Minnesota, but what we want you to know in the few minutes I have here today is we are Public Health 3.0 ready, and we're ready to accelerate you towards measuring and advancing health equity. Our philosophy is comprehensive agency management, and we can document evidence-based clinical outcomes on all kinds of clients, not just individuals or households or families, but also non-family groups and the community at large, and do systems level measurement and impact. Many people, when they come to us, are looking for an EHR for public health, and we were built expressively for public health in 1985. And we have 3 levels of documentation, including built-in scales or measurements and interventions for social determinants of health, and the ability to graph things like child growth charts, both tied to World Health Organization and CDC. But again, our philosophy, because it's comprehensive agency management, not just an EHR, EHR is only one of the functions that we provide. One of the things that caused us to sponsor this conference is we are very much into data management. And a lot of EHRs don't even think about managing program statistics or grant funding tracking or population outcomes, because we were built by a public health administrator, and that's what we've done. Those are very important to us. Nationally, we are centric in the Midwest. Colorado is surrounded by 3 other states that are using us right now. We can collect data from any and all of your programs. Our 170 counties that use us right now are measuring, documenting outcomes and encounters in 80 different public health programs across the gamut, from community health initiatives to walk-in clinics and everything in between. Our philosophy statement is this, that we believe that we must move from collecting data to using data, and we must convert the quantitative data to information, knowledge, and wisdom, or to actionable data. That's really the core of who we are and what we want to help you with. Here's a couple of quotes from our users. Champ provides real nice data I can get funded with. If we can't show the benefit or impact of our public health programs on the community, how we're going to get left behind, which just means you'll lose funding if you can't prove that. And then our data helps people get accredited as a public health department. And really our whole goal is to provide actionable data back to you displayed in 100 different ways so you can write your own success story. And we do offer our product in 3 different levels. And again, I want to thank you for allowing us to sponsor this and coming to today's session. And so just remember, Champ Software Community Health Agency Management Program, we're more than an EHR. Thank you so much.
Thank you so much, David. So today we have 2 presentations during this session. Each will be 20 minutes with this 10-minute break, 10-minute Q&A, and then we're going to have a 5-minute break between the 2 presentations. The theme of this session is youth-led public health, and it's really focused on youth contributing to public health efforts by leading community health assessments and improving adolescent health surveillance systems. Our first presentation is All Are Welcome, bringing faith, community, and government together in the development of a local resource center, presented by Angela Castillo and Olivia Becker. So I will go ahead and pass it over to them. Thank you both.
Hi, everyone. Thanks for joining us. Just want to make sure you can see my screen. Yeah, great. Okay, I'm Angela Castillo. I'm on the research and evaluation team with the Health District of Northern Larimer County. And you're also going to hear from Olivia Becker, who teaches at Wellington Middle High School. So the middle high school is new. It opened last year. Wellington is about 11,000 people, a little bit younger than the state overall. 29% of the population is under 18 years old, and about 11% is over 65. Wellington does have an urgent care and some smaller local providers, and is about 10 miles away from some other services in Fort Collins. So that cluster of symbols on the map is public health, human services, the food bank. The blue one is a behavioral health facility that's going to be opening in the next year, 2 years, something like that. And as of right now, there's no public transit connecting the region. So more about Wellington. About 11% of the population is living below the poverty level. About 15% of children are. 4% don't have health insurance. About 29% of adults said that they needed mental health services in the last 2 years, but didn't get it because of cost. About 15% live in a household where somebody needed mental health services and didn't get it in the past year. 14% of people are drinking more alcohol now than before the pandemic. And about 6% live in a household where somebody needed substance use treatment and didn't get it in the past year. And in Wellington, there is a pastor and his church that were operating a food bank, and they were seeing demand outpace supply, and they were seeing a lot of other needs. So this idea came up to create a local resource center that would serve all ages and house multiple services there in Wellington with increased availability.
Hi everyone, I'm Olivia Becker. So I'm the teacher at Wellington Middle High, which is a new school to our district this year. And I teach psychology and Spanish as well as health sciences. I also have 2 of my students here today, a 9th grader and a 10th grader who you'll get to hear from a little bit later. So thanks for being here. So this project started with the idea of a community services center from Mark Gabbert, who's a local pastor and also coaches at the school that I work at. He started a 501c3 called Grace Village to be able to fundraise and put together this community services center so that it wasn't all through his church. because it's a pretty big project. It's bringing together the food bank, human services, and then full-time mental health care through Summit Stone within the Community Services Center. This is a picture of our school grounds. It's beautiful. And this is the first year that we've had high school students. And so it's exciting to have a psychology class. And I wanted to create a project that was meaningful for them and got them involved in what our real community is doing. So we were invited to contribute to fundraising efforts as well as just community awareness for this community services center. So that's how my class got involved. I knew the man who's the brains behind this project, and he invited us to come help raise awareness. And then we did this event at the school involving 3 different classes, some business classes, art classes, and then our psychology class. So basically we had empty pottery where people could buy a pot and fill it with chili. We had business students making different products and selling them. It was right before the holidays, so they did holiday decorations. And then my students came up with some research presentations that the community could walk by and hear about. This Community Services Center has all the plans made as far as floor plans and partnerships with Summit Stone and everything. And they're leasing land from the church for $1 a year. So they've got everything kind of set up, but they're still raising funds to do the actual service. And then through my class, I had some connections at the Health District of Northern Larimer County. So I reached out to Angela, and that's how we got the actual community health survey for the data.
So the data source is, like Olivia said, the Community Health Survey. This is a triennial project. This is the 10th iteration. We invite randomly selected households to participate. We ask that 1 adult per household complete the survey. In 2022, we had 2,700 usable responses. So that was a response rate of 21%. And the survey is about 11 pages. So it covers a lot of topics, but we do get a lot of your basic demographics. We ask about insurance status, physical health, mental health, substance use, access to care, and a variety of other things. And the data that we provided to Olivia's class was just in this format. It was 2 tables, one for mental health, one for substance use. Each table listed all of the questions under that topic that were included in our survey. And then we gave the results for 3 geographic areas, one being Northern Larimer County, which is really most of the county. It excludes Loveland and Berthoud, but in terms of space, it is most of the county. We also gave them the zip code 80549, which is what Wellington zip code is, and then also Northeast Larimer County, which was Wellington and the immediately surrounding areas. And we gave all of these so that the class would be able to compare and think about what was most appropriate for their purposes. The zip code for Wellington had a small n, I think somewhere between 70 and 100 people. So it was low statistical power. And that's what we shared with them.
So if you are a 9th or 10th grade student, that last slide, the survey data looks pretty messy and you're not sure what to do with it at first. So part of my job was educating them about how to interpret that and also just chunking it into reasonable sizes. So we did have some great lessons on like sample size, because if we have 60 respondents within the Wellington community, it's not as powerful as the 405 respondents within the surrounding areas and farmlands as well. So we came up with some good lessons on that. I also divided out the survey data into kind of different units that we had gone through before. So we had some student groups working on mental health. We had some working on different substance abuse categories, some access to healthcare, such as insurance, or there was a question about people who needed to go to the doctor but hadn't gone in the last year because it wasn't accessible to them. So this was all divided up among different student groups, and then they ended up creating their own analyses and visualizations like the graph that you see in the upper right here, that we're able to connect the data that they interpreted to the actual needs of our community and basically why people should donate to this community services center. So as you can see in this graph, it's created by students. Some of them had used Excel before, some of them never had. So that was a really fun, hands-on way to do something that actually mattered to them. We did a couple renditions of these visualizations. There were a few drafts of correcting spelling, correcting scale of the graph, making sure that it was the most relevant data to tell the story that we wanted to tell. Here's a more fleshed out version of our process in class. I would say this project took about 3 weeks from introducing the concept to presenting at the fundraising event. So we started with an inquiry base in terms of, I asked them, what do you want to know more about when it comes to your community's mental health? What does our community need to know in order to get involved with this project? So what are our outcomes here? And then I find it really powerful to ask students how they want to be evaluated and have them help come up with the rubric, because then it's a very clear process of what they need to do and whether they are measuring up to the expectations. We did some brainstorming, so they took a few minutes to just write down anything that this brought to mind. In their dream world, if we had all the data we could get, what would they want to know? What would be relevant to this project? And then given that, we kind of broke up the research into about 4 days. The first day I gave them very structured questions and their couple of survey questions and responses to kind of analyze what they're looking at here, what matters in the data. And then by day 4, they were doing their own writing and extrapolating, again, the story that they wanted to tell based on the data. Then the analysis part came where they were working in their groups, this became very flexible as different people finished at different rates and students naturally kind of helped each other out so that the ones who had never used Excel before had another student expert. We also brought in experts, guest experts like Angela from the health district. Really helped that day that she was here just to have another adult in the room who could bounce around answering questions. And then finally, our final product was trifold boards that had the paragraphs students wrote about their survey questions, as well as one graph per group. And you'll get to see a photo of that later. So I have 2 students here with me. I'm going to give you a minute to read through some of the other student feedback, and then I will let Anya and Elena talk to their experience.
So we were doing like project-based learning to accomplish the understanding of this data. And so I was thinking about basically why is project-based learning important and what are the benefits of it. And one thing that I found really cool about it was that it makes learning more memorable, engaging, and fun. It gives you something that you actually connect to and can, remember, not just for the next test, but for a long time. Some of the projects this one that we did was a group project where we were working together in small groups for a greater outcome altogether. So we were each working on individual parts. I felt like this was also helps build friendships and grow more relationships, which I thought was really cool. One thing that was pretty difficult about understanding the data is that numbers can be really confusing sometimes, and that they just sometimes get jumbled in my brain. So it was really nice to have someone who could explain and help me figure out how to figure this out myself. And it was also interesting because I was able to learn that numbers mean things. And so as I was able to have people supporting me and help me figure out what this data means, I was able to portray this story of, okay, this is what these numbers mean. It's not a bunch of symbols. They represent something.
elaborating more on like the challenges of working with the data itself is you really do have to dig deep in order to find those meanings and stuff like that. And that could be a little challenging, but it was definitely helpful. Also, time management was a big thing. You had to incorporate like self-motivation into trying to get this accomplished and actually want to do it. Learning wise, in general for project-based learning is that like outside research we had found is very vital in the understanding and the like that aspect of project-based learning. And it allows you to like dig deeper into what you're learning about, thus, like she said, remembering more and making more of an impact. And that gives way into like real life application. So just like how this connects to the topic of the meeting.
Thank you so much, ladies. Well said. Go to the next slide. So to me, the educational purpose of this was a lot of what they just went over, that they were tying together previous units of study. We did a unit on mental health. We did a unit on stress. We talked about substance abuse. And so it was kind of bringing it all to a head at the end of our semester-long class. And then creating relevance within students' lives, because again, this data was specific to their community. So sometimes it was surprising, but the data we were looking at did apply to their neighbors, their friends, their families. And that makes the numbers, like Elena said, mean a lot more than if you're just looking at some symbols. And then they were able to contribute to our school event. Since this middle high is the high school in Wellington and the middle school in Wellington, it's really cool that we are using that platform to make a difference in the community and that the students were there that night to contribute to that. And finally, kind of like they said, when I look back on my learning as a student, there were several times that I was asked to memorize a bunch of information for a multiple choice test. And I kind of spat it out on that test and then forgot it the next week. And something like this, you don't forget, at least not as easily. Both of those students still have takeaways that they say that they were chatting with their friends about yesterday. So it made it more meaningful for them. Finally, here's our contact information. If you want to get in touch, you can email either Angela or me. And if you're interested in hearing more about the Wellington Community Services Center or getting involved, it's wellingtoncsc.org. Thank you all very much.
Awesome. Thank you both so very much. That was just incredible. Also really great to hear from some high schoolers as well. So thank you for that. It's time to open it up for some questions. So feel free to ask your questions in the chat at the bottom of your screen, or you can feel free to also ask your questions. Just unmute and ask your questions out loud. I mean, I'll ask just a broad question of how did you feel about speaking in front of everyone for the two of you that had an opportunity to speak? I see one of you in the camera. How's that feeling for you?
It was a little scary, not gonna lie, but yeah, it was good. It was nice to have a meaning for this project.
Yeah, absolutely.
Practice for you.
Yeah.
Absolutely. You did an incredible job. I was thoroughly impressed. So keep up the great work.
Thank you.
Any other questions from folks in the audience? All right, well, I think if anyone has any other questions, you all had the information up there for folks to take a look at. So awesome. Thank you both so much. Thank you all so much for your presentation. We're gonna go ahead and take just a 5-minute break to give everyone just a chance to move around and re-energize for our next speaker. So we encourage you all to get up from your chair and move around, or otherwise use this time for whatever you need, so you're ready to join us for the second half of the session. So we're going to go ahead and begin. Let's see, I'll look at my clock. Let's start back at just 1:33. I feel like it's a very awkward time, but 1:33. Let's do that. And we'll see you here in just about 5 minutes. Thank you all. All right. Welcome back on, everyone. Hope you got to have a little quick breather. So our second presentation is creating a youth feedback cycle to improve adolescent health surveillance in Colorado, presented by Christine Mulitauopele and Alyssa Plaut. So I'm going to go ahead and pass it over to them. Thank you both.
Awesome, thank you. Can everyone see my slides okay? I'm thinking so. So, awesome, thanks Samantha. Like Samantha said, my name is Christine Mulitauopele and I'm here with Alyssa Plaut. We are both from the Colorado School of Public Health and are here to share a bit today about our work creating a youth feedback cycle to improve adolescent health surveillance here in Colorado. I work on a survey research team that's contracted by the Colorado Department of Public Health and Environment to conduct 2 statewide surveys, the Healthy Kids Colorado survey, which we'll be focusing on today, and SmartSource. I'd like to give some quick recognition to my amazing team members, including Ashley, Ming, Sophie, Hannah, Katie, Anna, and Chelsea. And our team works very closely with our manager at CDPHE, Emily Fine, who leads this work at the state level. We'd also like to give a huge thank you to communities that participated in the Healthy Kids Colorado survey throughout the state, specifically school and district administrators, teachers and other staff, parents and guardians, partner organizations that advocated for this survey, and also worked with us on focus groups that we'll be talking about. And of course, the most gratitude goes to our young people that provided responses in our survey and volunteered to be a part of our focus groups. Before we dive into our content for today, I would love to learn a little bit more about who's in the room with us. So if everyone would put your response in the chat, I'm curious to hear whether you primarily work in quantitative research, qualitative research, both, or perhaps neither. And I'll wait just a minute for people to pop their responses in. Like Janice saying both, mixed methods, same with Olivia, a little bit more qualitative, Erica qualitative, Kelsey mostly quantitative, Phyllis neither. Just as cool, but both. Mixed methods. Oh, a lot of mixed methods researchers. Great. Well, you all can hopefully add a lot of perspective to what we're doing here. Jenny, mixed methods. Thank you. That's really useful to hear. All right. I know we don't have much time, so I'm going to give just a very brief background about the Healthy Kids Colorado survey. Hopefully it's not too duplicative of what you know about it. So this is Colorado's most comprehensive survey on adolescent health and well-being. It's given to middle and high school students throughout the state, and participation is voluntary and anonymous. The purpose of Healthy Kids is to better understand youth health and the factors that help young people make healthy choices. And we administer the survey in the fall of odd-numbered years. Most recently, this was fall of 2021, and we have our next survey cycle coming up this fall of 2023. We're contracted by CDPHE to recruit schools, administer the survey, analyze local and statewide data. We also have a steering committee with representatives from several state agencies and a larger advisory committee that's made up of different partners and stakeholders. And both of these committees are involved in decision-making and governing the project. Healthy Kids origin story, as we like to say, comes from the CDC's Youth Risk Behavior Surveillance System, or YRBS. And our state has participated in the YRBS in some way, shape, or form since 1991. So that whole surveillance system I just outlined for Healthy Kids and going back to the YRBS has been primarily developed by adult values and perceptions, from the questions on the survey to how the survey gets in front of students. And yet the purpose of the survey is to better understand young people. And we know that they are the experts on their lived experience And so if it's young people, we're hoping to better understand who better to hear from on a continual basis for improving these surveys. So with the goal of elevating youth voice at all stages in our surveillance system, our team has gradually built out a youth feedback cycle, specifically via youth focus groups. Given that we're a survey research team, I'll be the first to say most of our experience lies in quantitative data collection. And for quantitative folks, it can be really intimidating to dive into mixed methods or qualitative work if you're not familiar with it, or it just hasn't been a part of your system or process. So we wanted to pivot and make space for these incredibly rich, albeit messier forms of research. And we're here to share our applied practice approach that allowed for really nimble data collection and analysis with the goal of kind of demystifying qualitative work for any quantitative folks in the room and making it more accessible. So we'll be talking about 2 rounds of focus groups that we did during our presentation today. The first of which was done before the fall 2021 administration, and the second batch was done after. In preparation for the survey, we were charged with expanding questions around demographics and specifically those on youth identity, including sexual orientation and gender identity, with the goal of ensuring all youth felt seen and included when taking the survey. We specifically wanted feedback from LGBTQ+ youth in Colorado on our proposed questions and responses. And we needed this because we found there was really no single set of questions from authorities in this area for what to put on the survey. So we thought, who better to hear from than young people on how they want to be asked about their identities. Then following our 2021 administration, we wanted feedback from actual participants around their survey environment and experience. With rare exception, our team does not go into schools to administer the survey. You saw the list of our team members. We're pretty small but mighty, and we have between 300 and 500 schools participating in a given year. So we really rely on our streamlined support systems and kind of automated processes to provide schools what they need to administer the survey themselves. So these focus groups were incredibly important for us to hear directly from youth and evaluate key aspects to guide improvements. I'll mention our focus group guides. We developed questions and probes around a variety of topics and partnered with qualitative researchers at the Colorado School of Public Health for input on structure, wording, and flow. Both rounds of focus groups happened during times when schools were just tapped out, to say the least. And I think schools are still tapped out coming out of COVID. Big props to you, Olivia, for being a teacher, supporting young people in that way. So we knew that it was asking really too much of school staff to also serve as our access point for students in their buildings for these focus groups. And we also wanted young people to feel safe in the focus group environment. We know not all students feel safe in their schools. And so we wanted to partner with existing community youth coalitions that had well-established groups made up of middle and high school aged youth. Some groups were specifically focused on local health issues, while others were dedicated to LGBTQ+ advocacy. And working with these local youth groups really allowed for a quick turnaround when recruiting and scheduling focus groups, which can often be a barrier to implementing them. The trade-off for working with these community youth groups was introducing a potential bias as young people self-select into these groups, and they may not be representative of all youth in Colorado. So it wasn't perfect, but to help mitigate this, we utilized a snowball sampling approach where group members were asked to bring a friend who were not members to participate in focus groups with the goal of diversifying our sample a little bit more. Last, to incentivize participation in focus groups, we offered $50 gift cards and meals or snacks, depending on the preference of the group. And I cannot stress enough how important food is, especially at these groups that were meeting after school hours. So how did the focus groups turn out? a bit on their implementation. For our first round, we completed 2 separate focus groups with LGBTQ advocacy organizations located in Front Range cities with a total of 18 high school aged participants. And given that these were done in January of 2021, if we can all remember, many, if not all, activities were really restricted to being remote. So we used Zoom to facilitate virtual focus groups, and also Jamboard, which is like an interactive platform to try better engage with participants during the focus group. For our second round, which was done after our administration, so the spring of 2022, this was a much larger undertaking, and we completed 6 focus groups with local youth coalitions around the state in both urban and rural communities, with a total of 36 participants, both middle and high school age. All participants confirmed that they completed the 2021 Healthy Kids Survey, and we were able to do 3 of these groups in person, and 3 of them were conducted using a hybrid approach where our team's facilitator was virtual, but the focus group participants were meeting in person with their adult partner. Speaking of adult partners, they were truly invaluable for our focus groups, working with us for scheduling and coordinating, and perhaps most importantly, serving as that trusted adult in the room, which helped youth speak more freely and honestly about some difficult topics. I'll mention that we felt focus groups were successful in all formats, virtual, hybrid, and in person, and found that young people, much like adults, we learned how to engage via remote formats during the pandemic. And so we didn't see these as overly restrictive to our data collection, and really allowed us to reach more young people throughout the state due to safety concerns during our first round with COVID being more of an issue, and geographic obstacles. All right, I'm now going to turn it over to Alyssa, who we tapped as our qualitative research analyst, to share a little bit more about our analysis and reporting.
All right, hi everyone. Now let's talk about the analysis and report development process. For the analysis process, the survey team and I first reviewed the focus group transcripts to develop initial concepts and the analysis framework. Inductive qualitative coding was used, meaning all codes arise directly from the transcript data. Next, each transcript was coded individually by reviewing the text line by line and highlighting relevant or meaningful words and phrases. Initial codes were then applied to the highlighted sections, reflecting key categories as they emerged from the data. The initial codes are words or sentences that reflect what is being said in the highlighted sections of the transcripts. Initial codes and transcripts were then transferred to MaxQDA, which is a qualitative coding software, to be analyzed as a whole. MaxQDA was also used to organize initial codes into themed categories across all transcripts. After the codes were sorted into categories, all data relevant to each category was gathered and reviewed. Codes that did not fit the overarching themes were reorganized to ensure accurate representation of the data. All data relevant to each category were transferred into a codebook in Excel, and each code in the codebook was listed under its corresponding theme category with example quotes from each transcript. For the report development, the survey team and I worked together to determine which themes, codes, and student quotes best represented the focus group findings to include in the final report, which was then drafted and finalized for evaluation purposes. Key themes. Although the Healthy Kids Survey is a survey completed by and used to assess youth health and wellness, youth have rarely been asked for their input on how the survey is conducted and what topics are included. These focus groups began to address that gap. Themes emerged from the focus groups in response to questions about the survey environment, honesty when responding, feelings during and after the survey, what it means to be a healthy young person, and student understanding of how the data is used. Regarding the survey environment, we found that many factors contribute to the students' experience of the survey environment, including both interpersonal factors such as attitude of parents, peers, and teachers, as well as institutional factors such as proximity of student desks and when in the school day the survey was administered. Survey environment has the potential to impact the level of student participation as well as the quality of data collected. For the honesty when responding theme, we found that youth are comfortable answering honestly when anonymity is stressed. Youth are also hesitant to answer sensitive questions honestly, and belief that intervention is required when sensitive survey responses are selected discourages students from answering honestly. Additional themes that emerged while discussing honesty included a lack of trust in confidentiality due to the use of school-issued devices. Students also reported a sense of reduced privacy in classrooms where peers could see their computer screens from a nearby seat. Finally, a few students weren't sure if they were answering honestly because they weren't sure if they understood the question correctly. The next theme, feelings during and after the survey, we found that the emotions students had during and after the survey were dependent on their personal experience with the survey topics. Some youth felt uncomfortable as a result of taking the survey. Other youth felt neutral while taking the survey, and some youth reported feeling validated as a result of taking the survey. Regarding what it means to be a healthy young person, we found that for youth, health is balance, health is self-care, and health is acceptance. The youth mentioned that the survey questions did not always reflect what it means to be healthy, and they thought that health is very subjective and is influenced by their social connections and support systems, and that it should be approached holistically. The students reported that the questions could feel judgmental at times when they seem to present only two options. Either you select the healthy choice or you are not healthy. Students thought the responses should allow for more of a continuum of healthy choices. And the final theme is youth understanding of how data is used. Survey results are returned to district and school staff and designated community partners, but those adults rarely share the results back to the youth who contribute to them. While it may not be appropriate for youth to have direct access to the data, it could be empowering for them to review the local data to know how the data is being used. Across focus groups, we found that some students have a general understanding of how the survey data is used, but most students have very little understanding of where the survey data goes and how it is used. Youth also mentioned that the survey has limited potential to give youth a voice.
All right. Well, hopefully these focus groups are addressing that voice element. But what Alyssa shared was just a synthesized overview of some of the feedback we received. Again, such rich data comes back from focus groups. And we want to do our best at honoring the input and perspectives we were given from young people and incorporating these recommendations as much as possible. So together with our decision makers at CDPHE and our steering committee, we're pursuing the following changes that really fall in 3 bucket areas. So for the instrument, some examples of changes include additions of health topic areas that youth identified as important to their health and also missing from the survey. One example here is eating disorders. We will also be utilizing a write-in option for certain questions around youth identity to allow for even more representation. And improving instructions and reminders that are given at the beginning of the survey and throughout that better stress the anonymity of the survey, and reminding students that they can skip questions or even entire sections if needed. For the survey environment, our team will support schools in building awareness and preparation for the survey, especially classroom proctors, knowing they influence the environment the most. And we're currently revising our suite of materials with these youth recommendations in mind. This includes revising instructions about spacing out students prior to the start of the survey and ensuring responses are still anonymous, even on school and district issued devices. Lastly, for data use, we're exploring ways for results of the survey to be shared with youth in advance of the survey so they can see how their responses matter. For instance, we have an instructional video that classroom proctors play, and we're in the process of inserting some "did you know" references to 2021 results so they can see, oh, that's how the state used it, and giving some examples of some programs or evaluations that followed up on those findings. And this is really in part of a larger effort in working with local communities and the state to include youth in data review, as they're the ones who can help us make meaning of these results and really get to the why behind some of the observed outcomes. All right, I know I'm just about at time. So to wrap up, a quick mention of our plans moving forward. We will continue to expand upon youth focused groups into additional seasons of our survey cycle that I've attempted to visualize here. So while we've gotten feedback around instrument refinement and survey administration, which I'm representing with yellow arrows, we also plan to engage with youth at new points. So purple arrows here on the figure during our administration preparation, such as testing some of those revised survey instructions and materials I referenced, and after results are released, so that we can ensure what's asked on the survey, how it's asked, and what's done with the data best reflects the values and lived experiences of our young people in Colorado. For more information on the Healthy Kids Colorado survey, you can visit CDPHU's website here at healthykidscolo.org. I've also popped in a QR code if you feel like using your phone that way. And I just want to thank everyone for joining our session, giving us your time today. Here is our contact information. If you'd like to send us an email with any follow-up questions, I do know we have time now for Q&A.
Yeah, absolutely. Thank you, Christine and Alyssa, for that excellent presentation. I want to open it up for questions, so feel free to pop your questions in the chat, or feel free to just come off of mute and ask your questions out loud.
Hi, I wrote down my questions so when we got to this time, I wouldn't forget. So based on the number of youth that you recruited for the focus groups, did you meet your goal? Did you have a goal number? What did that look like for you all in this process?
Good question. For the first round, before survey administration, I think we had hoped to get a little bit more, but it was December. We were recruiting in December of 2020, coming into January, and it was just really hard to get organizations, especially we were honing in on LGBTQ advocacy organizations. So I think we had hoped for a little bit more, but we're happy to get 2, and they were from different cities, so a little bit more diversity there. And then for the second round, we really didn't know what to expect. We knew we didn't want to tap schools, like I mentioned, and had started, I think, with a goal of 4 focus groups. So we're pleasantly surprised with 6. Within those groups, there was variation in how many participants we had. I think there were some that were a little more disappointing, like 3 to 4 students, and others that were closer to our 10 kind of goal. So a little bit of both. I think I'll say that with this being kind of a newer endeavor for the surveillance system, we wanted to keep expectations low and just get the process started, try to be really nimble, knowing that such rich feedback is coming back even from these smaller numbers, and to continue to just grow with frequency and at different stages in the survey cycle.
Did you find that the snowball effect worked in terms of getting more diversity in the focus group?
For some groups more than others. I think it depended on the members' motivation to bring a friend. So I don't think it was always a sure win, but it definitely helped in some groups.
And then I think you mentioned in the second round you did some hybrid. I'd love to hear more about that. I am not in the metro area, so always appreciate when those of us outside of that area can provide feedback to statewide initiatives.
Yeah, again, we felt like it was really successful and would encourage other researchers to consider it. So we had a team of 2 dedicated facilitators to these, and they would travel when possible if it was like within a day's driving. But for those that weren't, we set up a Zoom room so we could see the room and the participants, and they had a camera, sometimes just like a laptop open facing the participants, and either a mic or just the computer's mic for audio. If it was just the computer's mic, we had the adult partner who was also in person with the participants help us with the recording either on their phone or something that was a little more reliable. And I think in those instances, the adult partner helped with a little bit more facilitation as a co-facilitator than when we could go in person. Any other specific questions about that, Kelsey?
No, I don't think so. I'm just trying to envision it. I know that it can be challenging, especially you said if it's hybrid, where it can, those not in the room physically can get forgotten. So I just always appreciate any sort of thoughts on how to facilitate a setup like that.
Yeah, I will. So the hybrid approach we did, all the participants were in person and together. I feel like that dynamic was really helpful, just filling spaces when talking and reading each other's body language. In our first round, January of 2021, participants were remote. And so we weren't able to have that advantage, but they couldn't have happened otherwise. So we took what we could.
Okay, so I think I misunderstood like what you meant by hybrid. So it was like in one location physically and the facilitators were elsewhere potentially.
Yeah.
Okay.
The adult partner with the youth coalition was in person with focus group participants, and then the facilitator from our team would join virtually.
Gotcha. Thank you for that clarification. I had a different image in my head.
Of course, sorry if I was unclear.
I have a quick question as well, to pop in. I think, and hopefully I'll express this correctly or like in a easy way for you to understand, but I think that the project that you all are doing is just really, really great. And I think when it comes to the communities that when you're trying to implement these changes, how are you all representing that to this like youth, you know, and kid population? Because I think sometimes like, you know, you're presenting it here to us, but how do they know and understand that the changes that you're making are being included? And I know you touched on it like a few things, but I was just wondering if you could kind of expand on that and like how just in general we can better ensure that when we're, you know, collecting the data, how are we not only implementing it, but like having that feedback loop is kind of what I'm asking.
Yes, totally understand your question. It was something that we asked ourselves before we even started. There is a huge value in Healthy Kids survey, its origin story for giving data back to communities, like not just sucking it up and using it for our research purposes. That's why we give reports back to schools and districts. So with the focus groups, that was top of mind, making sure that we would go back to these organizations, to participants, and let them know like, hey, we heard from you. Here's this like really high level aggregated report, but these are clear examples of how you made a difference and how you improved this for other young people. We're still in the process of finalizing those changes so that communication hasn't gone back, but it is on our to-do for either the end of this spring semester or summer, depending on a few things, but that is definitely happening.
Yeah, absolutely. And can I just clarify? So do you send it just to like the individual schools? Or are you sending it to like the participants specifically that went through the focus groups? I'm sorry if you already made that clear and I just missed it.
That's okay. I might have conflated things. So for focus groups, since they all came from youth coalitions or organizations, that would be who we'd go back to with information about how their focus group participation helped us make changes or make improvements with our surveillance system. What I was talking about with schools is for Healthy Kids, the survey that students are participating in across the state. We give data back from that survey to schools, typically administrators, and to districts. And we know that there's a gap where that often doesn't get back to youth. So we're continually trying to make sure reports are shared with young people in their communities too.
Absolutely. Thank you so much. That's awesome. I'm really glad to hear you all are thinking about that as well.
I see we have a question in the chat from Rebecca about other health categories that got added to the survey. Another question, one that I think Alyssa even hinted to, just about balance and overall well-being. I can't speak too specifically because the instrument isn't publicly out, but we did expand questions in our mental health section about just general mental health and how youth would self-report their mental health on kind of more of a regular basis instead of just extremes like depression and suicide ideation. So that's another instance. I think those are the two that I think most directly were driven from focus groups. So I'll stop there. Any other questions from the room?
Yeah, I was going to say, I think we have time for like one last question. So, or maybe I'm speeding us up too much. I think you have a little bit of time to ask a couple more questions. So feel free. I'm looking at the time wrong, apparently.
All good. I'd love to hear if people are willing to either come off mute or just chat more. For those of you who do work in qualitative research or mixed methods, if focus groups are one of your collection methods, and if you have any tips or recommendations kind of based on what we outlined in our process. And maybe not focus groups.
Hello, I'm Erica, representing West Central Public Health Partnership and located in Gunnison. We just wrapped up our health assessment and we didn't do focus groups, but we did key informant interviews. And I just want to commend you guys on the qualitative data because that is a beast, wrangling all of the quotes and coding and then managing that data. Yeah, so I commend you guys for doing that because I know it's a lot.
It really is. All props to Alyssa. And I do feel like we had an advantage being in an academic institution to pull from different research styles and research backgrounds and experiences. I will put a plug for any of you who are doing quantitative work and want to expand qualitative work. The Colorado School of Public Health has students who need capstones and would love like real life applied scenarios or data to work with. So if it's really just an issue of capacity or skill set, reach out to the School of Public Health. You can start with me and I'll try to direct you to the right people, but I know that's always a need. So
I will second you. I am a student at Colorado School of Public Health, and it is April, and lots of students are looking for practicum opportunities in the summertime. So if you have any work that needs to be done, I know that I have several students who have asked me questions like that, and qualitative work is always something that comes up in students' mind, wanting to really like use that muscle. So sorry to put an extra plug in there, but that's definitely a great thing. Okay, awesome. Well, maybe we'll just, awesome. Thank you all for being here with us today. And thank you for that wonderful presentation, the wonderful presentations. We really appreciate all of your time. So thank you again for attending this session and for engaging in our Q&A. I just want to do a few short announcements before you head out. Slides and any additional handouts that the speakers have provided are available on, I think they pronounce it sked, or I always say shed. However you personally pronounce it. And then you will receive a conference evaluation form via email after the conference is over. So tomorrow, the Culture of Data conference will be over, so you'll receive that via email. And please fill that out, even if you only attend a portion of the conference. It is very helpful for our planning committee, and there will be a raffle for everyone who completes the survey within 2 weeks, and you could win one of two $50 gift cards. And then, oh, I think that's all of my potentially announcements. Oh wait, hold on. So the sorry about that. The next live session begins at 2:45. And is another concurrent breakout. So please see the full schedule on the conference website to determine which breakout you want to attend at 2:45. I will hang out for just a couple more minutes. Oh, I'm sorry, and I didn't announce that. Now we have a 30-minute break during which we encourage you all to listen to the recorded walk and talk sessions. So right after this is our walk and talk sessions while you step away from the screen. There are 2 presentations for you to choose from in the walk and learn sessions on the community voice in health and environmental assessments. So you can pick between the 2 of those. So we encourage you all to kind of get out and go for a walk. It's a very beautiful day. If you are in Colorado, I know that it's a very beautiful day kind of down in the Denver area. Awesome. So I'll stick around for any questions for just a couple more minutes. But again, just thank you all for being here. And I hope you enjoy the rest of the Culture of Data conference.
Thanks so much, Samantha.
Yeah, thank you, Kelsey. Sorry if I was a little confused on some of them. I was trying to.
You're good. You're good.
I got confused at that last note because it was like, it just says announcement it says announcement for all sessions. And then it says announcement at the end of concurrent session 1. And I was like, I just got confused. I thought I was like, oh no, was I supposed to say that after the first presentation? Anyway, I was like, oh no.
No, you're good. You're good. Yeah. A note for us to like, some of those we have in there because like they make a template and then we erase the ones that aren't relevant. And so we can think about how to make it flow better when those edits are made. So it's just like one list of bullets perhaps.
Oh my gosh. No, and you know what? It's like partially like my fault too, because I just like was rushing from one meeting that I was facilitating to this, and I hadn't read through like all of the stuff and just at least got like, I tried to like quickly digest it. And so hopefully that went okay, but I apparently volunteered myself for too many things. I'm like over here, like, what are we doing?
No worries. It was great.
Yes, absolutely.
You always, we're always our harshest critic.
I know. I'm like, any tips? I have to do the tech for this next one. I'm like, is there anything that I need to like know or beyond just what's on the thing? I know that, but
no, one thing, and this might be, I'll ask the group for next year. Usually when I set up meetings at a certain point, I turn off the waiting room because then it's I don't want to be keeping an eye and constantly like having to manually let people in. I did not do that. And so I may have been on a different screen at a different point and people sat there probably longer than they needed to because they kind of hopped on in the middle and I wasn't expecting that. So I guess be prepared. Maybe people will come in mid-session because they wanted to hear the second presentation. I did notice a few hop on at that transition point. And in the future, I'd ask if people, I think I'll probably, when we do our wrap up about this, ask like, are we comfortable if we, turn off the waiting room so people that log in late, especially really late, can just get in and we don't have to manually let them in, or what our thoughts are on that. But for now, keeping an eye on it, especially at that transition time.
No, such a good tip. Like, I absolutely love that. Yeah. I'm like, I think today is the only day that I signed up for something. Yeah. Yeah, everyone had taken the next day by the time I did it. So I'm like, amazing. I have one more session and then I'm like just going to my own session. So excuse me.
Nice. Yeah, both of mine are today, but that's just because I couldn't help out in the morning, and bless you.
Yeah, I was just trying to help out where I could, and I'm like, oh, well, I need to make sure that I'm all sorted. So yeah, I think I'm gonna hop into the other session like really early right now, actually, because they were saying that did you see the email that they're having? Okay.
Yeah, I might have been one of the first people. I don't know. I had to text Rachel and I was like, hey, it's asking for this code that I can't get to. So it really wasn't, it's more the hassle on her end, I think, than ours. It wasn't, she just texted it to me and it was easy to get in once. And she was really responsive. So.
Yeah, absolutely. And Kelsey, are you on the planning committee as well?
I am.
Okay,
Yep,
gotcha. Yeah, I've kind of like tried to help out, but then also like I help out with other things at CPHA. And so I'm like, I just cannot. Yeah. So, you know what? I had another thought too. This is just like of such super subtle, but in the moderator guides, oh, I guess you labeled them A1, A2, A3, A4. Okay. That's probably just me being silly, maybe. Because I was almost thinking it would make sense to put like the times like together in like another folder. I know it's like a folder within a folder or something, but so maybe that's not helpful. I see that you labeled them.
Well,
It's me anyway.
yeah, no, I wonder though if we should start the name we need to start the name with the number and letter, because I have to cursor over it for it to show up, and
Yeah,
that's not efficient. So
yeah,
I had that thought earlier as well.
yeah. No, this is really well organized. So these are just like super little things. Like Allison and everyone on the team has done such a fabulous job. So this is like super subtle. I just kind of like when I got in there kind of in a rush, I was like, oh my
Which
gosh.
Yeah, no, and I think I mean, we're at that point where like we have all these things that were put together over the last couple of years that we can just copy and then make better each time. So like this time I didn't have to make anyone co-host, and I don't know why. But last year we did. So it only allowed me to make people host. And I was like, well, no, then so I don't know what sort of settings were different in Zoom on the back end. It must have been set so everybody could share their screen. I don't know, but just little things like that come up that are a little different each year.
Yeah, no, like I said, I was just facilitating another session for like work. And like, I swear to you, it's like you learn something every single time you facilitate. It's probably like one of the most annoying learning curves though, because you're like, just when you think you have it, then it's like, you're like, what? Some sort of other tech issue that you never thought imaginable like happens. And you're just like, what is happening?
I like it when it's a positive learning where someone like told me about the enabling or unenabling the waiting room. And they were like, usually we just turn that off when, once we're in the middle of the presentation, so it doesn't keep popping up for those that are the hosts. And I was like, what is this?
I didn't know you could
magic?
do that either. Like literally, I still think I like need to get more techie on some of these things too, because I think it would help with a lot of these issues that I know that I have even at work. So that's awesome. I like that. I'm definitely going to take that thought with me forever now. So, well, I'm going to go ahead and hop over to the other session for like, just in case purposes. But Kelsey, it's so nice. I feel like we've met like before or something. Like, I mean, so we probably have met before is what I'm getting at, I think.
And I know I share a lot of your things on LinkedIn. So like, it could also be just that. I don't know, because I was on the committee. I was the culture data director, but that was several years ago. So it's been 3 years ago that I was something like that. It's been 2 years of me not being it. So but so nice to chat with you.
I know. Well, I joined CPHA like about 3 years ago. So maybe that is also
a little
like
overlap.
little bit of overlap. So yeah, and then I've just been like actively involved ever since. So it's really nice of you to continue to help. Like we really appreciate it at CPHA. So I know you feel probably the same way, like when you were leading and doing that as well. So it's very
Absolutely.
nice.
Yeah, it's been great. We have like a whole new committee this year. That's been awesome. Like we had some, really committed committee for a long time, and life happens. And so it was nice to see a transition as well, and it get a little bigger. That's helpful.
Well, and the emerging leaders, like we're really trying to, because I'm the director of the emerging leaders committee, and we're really trying to like bring other people in. So I'm so grateful for the emerging leaders showcase. So literally like I'm so grateful, like super excited. So that was like one addition this year. We were like Allison was on it. Like when I mentioned it last year, like she was like, we're doing this. And I'm like, oh, thank you so much. Like for the support, and like, I don't know, it's just very great. So
Yeah, absolutely. We're excited to have it and the support, it's just all the different committees. So, all right, well, I'll let you figure out your login.
all right, bye, Kelsey.
Bye.